Hello everyone, this is Dr. Sushma Sarilla, consulting homeopath at Fidicus Homeopathy. Now let's get into the investigation part for this vaginal candidiasis. As soon as you're experiencing these symptoms, when you consult a doctor, the first thing they would do is ask you about the symptoms and do a physical examination. That means they will examine your vagina. And after that, even if they are not able to confirm, they will do a wet mount. So what is a wet mount? As you can see here in the picture, they will take a drop of your vaginal discharge, they will put it under a cover slip along with some other liquid, and they will view in the microscope for better understanding of the problem. And also, not only that, if the wet mount is not suggested, sometimes they will be suggesting culture so as to know which kind of species is affecting your vagina. And also, vaginal pH testing is very important because alteration in the vaginal pH will only cause this bacteria or this yeast to flare up in the vaginal part. And PCR, which is polymerase chain reaction, to know specifically what kind of species is affecting or causing these symptoms. Additional tests, HbA1c and immune function test. Why do you have to conduct HbA1c is that people who are already suffering from diabetes mellitus or who do not know or undiagnosed cases of diabetes mellitus can have recurrent vaginal infection. To get to know if this vaginal recurrences or vaginal yeast recurrences is because of diabetes, we have to get HbA1c tested. And also low immunity or people who are under immune suppressions also or immune suppression therapy also suffer from recurrent vaginal candidiasis. So to know if it is because of low immunity, we have to do this additional test. Coming to the consultation part, if you are viewing this video and you are suffering from vaginal candidiasis or any other female reproductive system diseases and you want to consult us, you can do it in two manners. One is coming and visiting us in person. If you're near the nearest branch of Fidicus, you can come and visit us in person. And if you're far away and you would like to get in contact with us, you can do it through online consultation, which has audio as well as video consultation. After doctor consultation, we will ask you for necessary investigations, or if you have any investigations, you can share it with us. After doctor consultation, our medications will come to your doorstep through courier delivery. If you're staying in India, it will take at least 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. And if you're staying anywhere else, it will take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in contact with us and know about the doctor consultation or more about us, you can call us on this number, WhatsApp us or message us. If you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you are suffering from vaginal candidiasis or any other female reproductive system diseases and you are looking for a proper cure, then why should you choose Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. First is already the cases which are suffering from vaginal candidiasis or any other female reproductive system diseases, we have high success rate in them. And also the transparent treatment, that is, we will be telling you and educating you on the prognosis and what your case is, and also the personal care we take here at Fidicus Homeopathy. If there are any sort of myths that are attached or stigmas attached to your disease, we will be clearing it off and we will be educating you on the disease. So if you want to choose health, if you want to choose cure, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.